Hello and welcome to another exciting appointment, your doctor's appointment on television. It's time for We the Doctors. My name is Dr. Jules. I'm sure you're wondering where we are. We are at a furniture store called Sam Vic's Exquisite Furniture Limited here on Sanusi, Victoria Island, Lagos. And I must tell you, these seats are quite comfortable. As you can see, myself and my colleagues, Dr. Oke, Dr. Yvonne, and Dr. Valeria are feeling at home.
Very comfortable.
Honestly, this is 100% Italian leather. It is very, I should know because I have this in my house.
Oh.
No, really.
Anyway, so there you go. They should shade whatever, however they want. But today we are going to focus on our primary duty, which is to explain health conditions to you so that you make better healthcare choices. Today's topic is something that is very embarrassing for a child, especially when it comes with things like wet pajamas, wet bed sheets. I'm sure you know what I'm talking about. We're talking about bed wetting. It can be really, really embarrassing for that child. And I know very frustrating for some parents. So I'm sure you're wondering, as in, could this be a problem for the child? Is there something wrong with the child's development? Don't go far because the doctors are here to explain it to you. We're talking about the myths. So let's start it off. I'll be calling them out and my team of doctors will be talking about it. The first one is laziness. When a child does not get up to go to the restroom at night, is the child lazy?
No, it's false. False, very false. Because as a child, being a child, the bladder is small. So you don't expect it to be as big as the adult bladder. And by the way, the child at this stage can't recognize as a full bladder. So while asleep overnight, of course the child is bound to pee. Especially after drinking all the sorts of things, all kind of drink that they drink every day. So the child pees. It's not because of laziness, but the child's bladder hasn't yet developed to the extent whereby he or she can recognize that the bladder is full.
So please, the child is not lazy. Another thing, punishment helps. Some people feel when you flog that child very well, will stop.
You know,
is that true?
We get that a lot. A lot of time, a lot of parents assume that once you punish your child or you flog that child will stop bedwetting. But as a matter of fact, it doesn't really help after all, because you know it's like flogging someone for sneezing. For sneezing. It's supposed to be an involuntary action. However, for some children, especially the older children who bedwet, their punishment can have a role to play in that particular instance.
I don't agree
with punishment.
A role to play that they will stop.
Not unnecessary punishment.
In psychology, you call it cognitive behavioral
therapy. I agree with you.
Of which flogging is not part of it.
No. There are different forms of punishment. It doesn't always have to be flogging. Do you understand what I'm saying?
So
there may be
like
incentives added to it. Exactly. Corrective measures.
But not punishment.
But not
I don't like that word punishment.
Yeah, but it's part of corrective measure. It's not something you're doing, you're enjoying when you're doing. So it's punitive.
No, like for instance, if there's a young child, I'm thinking of a child that is above 6, and for instance, they wet the bed, they know they have to get up.
Yes, a 10-year-old child. Yes, what's the brush sheets?
You know, make them.
So you know that each time you bedwet, you're going to wash the sheet.
Yeah.
So then you probably want to cultivate the habit of weeing before you go to bed, or talking about the other things you'll be talking about later, other ways of
exactly. So it's not, we are not talking about you smacking the living daylight out of that child. So you want to be very careful about that. So the next one we are going to talk about is bedwetting. Does it mean that the child has a true medical condition? That is absolutely false, because like Dr. Yvonne mentioned earlier, it's an involuntary action, especially for children less than 6 years. Now, one thing I will mention is if the child stops bedwetting for a period of like 6 months, and then all of a sudden the child just starts bedwetting again, that is a red flag. So
you can be thinking about a medical condition.
Then you can be thinking about the medical condition. So that is the fact to consider. Another myth that we're talking about is all children wet at night for the same reason. Is that true?
I don't think it's true. I think basically you have to ask yourself, what is the reason children wet at night? Parents can't even find out the reason.
True.
So why do they assume that all children will have to bed wet at night for the same reason? Basically, that's a false statement doesn't work that way.
It doesn't work that way.
No, but there's a general assumption now. The child will not sleep in the afternoon and you expect the child to bedwet. So most time people just, that's why they call it nocturnal anorexic. They expect that children bedwet at night.
Yeah, they think
it's only the night and
they just think it's as in it's a general, is a norm. Let me put it that
exactly.
way.
So they capitalize it as the whole normal process of things that happen around.
So long and short of it, it is not a medical problem.
Yes.
Now, poor potty training, is that part of the reason why a child will bedwet? Is it?
Pretty much, it has nothing to do with it, really.
Basically,
yes.
like
so the fact that the child you didn't train the child properly on how to use a potty, and then that's why the child is bedwetting, it's not even bother.
If the child is within that age, less than 6, where they still don't have control over
right now we are beginning to sound like we're defending these children. Some children on TV right now will be dancing.
No, but parents have to get it. Because I've seen mothers beat 3-year-olds because they were bedwetting. I've seen mothers go as far as going to school to tell schoolmates that a 5-year-old.
But the funny thing about all these things is that go and check these parents. I'm sure when they were at that age, they were bedwetting.
Yes, because the gene is a part of the problem.
True, exactly. Another thing that people talked about also is boys wetting the bed more than girls.
Yes,
is that
statistics.
You will say yes.
Statistics
No,
anyway.
Statistics. Let's agree. Statistics says
boys.
But let's think about it. There are more boys children than girl children.
Really?
No, not necessarily.
No.
Sometimes they relate it with stress.
Exactly.
On the child, on the part of the child, on the male child.
You are talking about the causes.
Yes.
When we come back, we'll be talking about that. Let's take a quick break. When we come back, because they like to argue. When we come back, we'll continue today's topic. It's bedwetting, and you're watching With the Doctors.
Coming up next.
Years of age, however. But the thing here is that there's something I want to say. At birth, there's a hormone called antidiuretic hormone, ADH, which is not produced in a child till the child is about 3 to 6 years of age. What this hormone does is that it actually helps hold urine. It prevents, as in production of. Hi and welcome back. It's We the Doctors, and today's topic is bedwetting, also known as nocturnal enuresis. We've had a very interesting conversation going along, but in this segment, I'll be talking to you about the causes of bedwetting. Before we start, we talked about it earlier, Dr. Joe said it, that bedwetting is the involuntary passage of urine while one is asleep, after the age in which one is meant to be dry. Anyway, it has an age range of which sometimes it actually spans above 6 years of age, however. But the thing here is that there's something I want to say. At birth, there's a hormone called antidiuretic hormone, ADH, which is not produced in a child till the child is about 3 to 6 years of age. What this hormone does is that it actually helps hold urine. It prevents, as in production of urine, so that over the night, it's released at night. Over the course of the night, one is able to sleep without having to stand up to go and pee. But in children, because it's not produced at birth until about age 3 to 6, it's not present. So that's what causes these children to actually pee at night. And we also talked about something earlier, talking about the child is not able to recognize the full bladder because the nervous system is not properly developed. So these and many more causes which we'll be talking about. But let me take the first one, which is the small bladder. Children, they are small, and so they have small bladders, and so these bladders fill up on time. When they are asleep, of course, they don't know what is happening, and with these factors I just talked about, they are bound to pee on themselves. So that's the first thing I'm taking.
Okay, and we also have infection. So sometimes I don't know why people feel that you can only have urinary infection, UTI, in an adult. Kids can also have bladder infection.
A lot. Kids even usually have urinary tract infection a lot of times.
Exactly.
Because of nappies,
Yes.
But another thing to understand, when children have infection, one thing you notice, especially in a child who has before regained control of the bladder at night, and then begins to pee again at night on the bed. That's when you have to begin to suspect this child may have just had an infection. Then take the child to the hospital.
Yes. So, and it's very important as well, because things like urinary tract infection can present as a fever. Sure. So when you're at home, we know we all like treating malaria, and we do all the form of self-medication. It is very dangerous when it comes to kids. You have to see your pediatrician. Now, we've said it that apart from a fever, urinating often for a little child can be an indication of an infection. And then also chronic constipation because of the diet of the child. When the child is forcing and the floor, if you are a fan of witch doctors, you know that we talked about urinary incontinence and the importance of how strong the pelvic floor is. If the child is constipated, the child is always pushing, the floor of the pelvis will be very weak, and that child will be prone to bedwetting.
Yeah, Dr. Yvonne, let me borrow a line from you. You know, earlier on you talked about ADH, and then you mentioned this to be a hormone that prevents urination, produced at night just to reduce excess urination. After 3 years, what happens? When a child continues to pee, beyond 3, beyond 6, beyond 8, 10 years keeps peeing, I think I would suspect that the child may have an ADH imbalance. Not producing enough, and I'll go ahead to investigate the child. So for parents, sometimes when it's at that point, you have to discuss with your clinician in the hospital, and when he thinks about that, he's going to, consider investigations for your child. That could be a reason for the neurosis the child is having.
And apart from UTI, which Dr. Jules talked about earlier, there's diabetes. This is usually this urination at night is usually the first sign that your child could possibly be having diabetes, especially after a long period of dryness.
Yes, and kids do have diabetes. Yes,
and then even adults that bedwet. Sometimes they tend to blame it on diabetes. And yes, as a matter of fact, basically. And then initially she was talking about inability to recognize the fact that you want to urinate. So we're talking about the fact that the brain is not fully developed yet, so the child doesn't even know that he wants to pee at that particular point in time. And then earlier on, before we went on the break, we were talking about stress being a factor, especially for male children, basically. And then you realize that when they get to a new environment, they just get into a school, for example, private school, or the boarding house facility and all of that, the whole stress of trying to acclimatize into a new environment. The next thing, especially those who go on the bunk, you put that child on top, and then the one on that will open the mouth while he's screaming, and then he's just urinating inside his mouth. This thing happens anyway.
Well, these are many more causes, but anyway, we will still like to hear from people on the street, the reasons why people bedwet. So please do not go anywhere, because we'll be back shortly after the break.
I believe children, or depending the age, maybe enough water and adults and all that. But for adults, it's not for everybody. Any adult that is doing that, I believe, is a sickness. That's what I believe.
Bedwetting. Every children will like to bedwet. Depend on the way their parents take care of them. It gets the stage that you normally wake your children to let them peace in the night, time to time, like at least 2 times before daybreak. Gradually, we master them, but some erit bedwetting, and in Africa, they can use it as punishment to the parents.
Children, I think it's because they eat late. Because I have a kid, whenever she eats late in the night, she bedwets. And even maybe she takes a lot of liquid, then she bedwets. But if not that, I don't see any reason why they should. Or maybe they play a lot during the day, so in the night they just sleep off and they think they're still playing and they find themselves bedwetting.
Okay. I can say that one of the major causes that cause bedwetting is that when a child overeats and there is no proper control in that feeding, and by the time he went to bed to sleep, that can be that child to wear the bed. Apart from that, also lack of parental training. When the child is not properly trained on how to discipline his body, how to control his body, that can also cause bedwetting.
Okay, I would say that is because of too much play. The children, most times they will play and play away their senses. If you caution them to stop playing, most times they will feel you are doing them bad thing. But at night, when they are so weak, they won't be able to wake up at the time they're supposed to wake up and and ease themselves. That will cause them to bedwet. In adults, I think it's maybe most of them is sickness. Sickness can cause it, and to me, I feel it's sickness that can cause adults to bedwet.
If it's children, too much of playful, all those kind of things, they play a lot, and their parents must take care of them to wake them up in the midnight so that they will not bedwet. But in the adult, it's not normal. That one is like abomination to hear that adult is bedwetting. Maybe a sickness or something else spiritually. That's all I can say.
Hi and welcome back. It's With the Doctors. I'm Dr. Yvonne, and that was a very interesting discussion we just had now, talking about bedwetting. Oh, how people open up to talk so much about bedwetting. Anyway, we're going on this topic, and we have a very lovely guest with us here today by the name of Dr. Efosa Elliot Aigbedo. You're welcome.
Thank you very much, Dr. Yvonne, for having me on the show.
Yeah, that's nice. Anyway, we've been talking about bedwetting, which is our topic for today. Yeah. And before we even start, we have so many questions. We discussed a lot about it earlier, but we still have some questions we'd like to ask. But before I even start, I want to ask you a very personal question, and I hope you don't mind. At what age did you stop bedwetting?
Well, to be very frank with you, right? I think I bedwetted up to the age of 9, 10. I think so.
Okay.
But, I mean, everybody or 80% of people stop bedwetting at the age of 10, 11. Yeah. If I'm going to take a poll now and say, what age did you stop bedwetting? Or did you ever bedwet? I'm sure you say yes, right?
Of course, yes.
And I bedwetted as well.
Yeah.
So, in this way, so far so good. We already have 100% of this population bedwetted, right? So, of course, I stopped at the age of 9. And I'm sure if I'm going to ask you as well, you stop at the later age than me.
Oh, please. Okay, I wanted to ask again. How often do parents come to you complaining about this issue of bedwetting when it comes to their kids?
Well, the issue of bedwetting is sometimes people, well, if I'm going to rephrase, people take it as a very coded issue in the sense that when people bedwet at home, right, the parents most of the time don't come to the hospitals to complain, right? They want to take the disciplining and the training into their own hands, right? A lot of people believe it's a normal thing. Some people even think it's very spiritual, right? But coming to the clinical setting, we have, say, give or take, 8 out of every 10 patients that come with complaining with their kids. When we ask them, they say the kids still bedwet. Now I'm talking about kids outside the normal age of bedwetting, right?
Yes.
Which, I mean, it's a very high population.
They don't come to you directly complaining, saying, okay,
my
child still, okay, it is along the line.
It's along the line when you're asking questions, you know, you want to know the history. Do they sleep well? Do they eat well? Do they bedwet? And they say, oh, yes, they do bedwet. Yeah, so that's when it comes up.
All right, good. So at what age range is this usually common? Like you said, most people stop at 9, 10. Yeah. But at what age range do you see a lot of people, like children, bedwet?
First of all, the normal age for bedwetting, right, is, of course, from birth to the age of 5 years old. Anything below that age is normal for them to bedwet. Yes. Why? Because they haven't fully mastered the act of bladder control. They haven't fully mastered, okay, when I need to go to the restroom, I need to wake up to go do that, right? But what we see is, in the clinical setup, right, a lot of people above the age of 5 still come to the hospital, right? And then that's when we now call it an abnormal condition. Yeah. Okay. And at that stage, we now have to give different, you know, recommended treatments or lifestyle modifications to actually help with that.
Coming to my next question, I want to ask, what lifestyle change have you, as an advised parents, to like start for their kids that they come complaining about this issue? As in, what lifestyle change have you been able to advise them to adapt?
When it comes to managing or controlling bedwetting in children, right, you have to tailor it to the particular child in question. Right. For example, child A and child B may be bedwetting, but their cases might be totally unique. Yeah. Right. So different things, if we're just going to go across the board, there are general managements we use. Okay. First of all, we have to tell the parents that once is 6 o'clock, 7 o'clock, we have to reduce the fluid intake of the child. Okay. Right. in the morning, in the afternoon, they could take as much fluids as they like. But once it's 6, 7 p.m., you have to reduce the fluid intake. Why is this? The less fluid in the bladder, the lower the chance of them bedwetting, right? Another thing that happens is a lot of people take sodas, right? Now, sodas contain a lot of sugars, right? So what happens is when you take sugar or sodas, for example, it increases the concentration. And of course, when you know osmosis, fluid shift and the likes, it also makes fluid accumulate in your bladder and they want to urinate as well. So we also advise patients to limit the amount of sugary stuff the children take, especially sodas, towards the evening part of the day. Another thing we do is there's something they call a bedwetting alarm, right? What happens is it comes in a very funny form. You put it on the bed. Once liquid touches or comes in contact with it, it sends an alarm, right? So that could also help to build the cognitive development of the child, reducing the chances at leading to bedwetting. Those are like the major things we use apart from medications and the other likes.
Very interesting. And I'm sure so many people are wondering that you're talking about children. How about the adults? So you want to tell us a bit about bedwetting?
that's the funny part. You know, sometimes in the clinic we have some husbands come in. They come very ashamed, right? They don't even know where to start from because they have problems with either them bedwetting or their spouses bedwetting, right? So adults also bedwet. Now, when adults bedwet, it's totally abnormal, right? And then we have to really, really investigate to know the cause, to know the risk factors associated and how we can effectively manage it. Because trust me, when an adult is bedwetting, it's a very, 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 very sad event.
Completely. Thank you so much, Dr.
You're very welcome.
Thank you. It was a very lovely interview. And, well, I want you all to stay with us because we'll be going on a short break and we'll be coming back. When we come back, Dr. Waleria will be taking us on the next segment. So please stay tuned. Don't go anywhere.
Thank you.
Hello and you're welcome back to We the Doctors. If you're just joining us, we have been talking about bedwetting. My name is Dr. Waleria. And it's been an interesting, episode. And it was quite interesting listening to the guest earlier on telling us about, how he was used to bedwet as a child. The only difference is that he didn't tell us the age at which he stopped. Yeah, well, I guess maybe he stopped in teenage years or something.
He did.
Oh, I didn't pay attention to that. I wasn't even listening to that. Anyway, people can say whatever it is, but only God knows the truth.
Exactly.
We hope one day people will be bold enough to tell us the truth about this, issues and all of that. And this segment will be telling you about how to help that child stop bedwetting. I think one of the most important easy ways of doing it is, having the bedwetting alarms, putting alarm clocks right beside them and all of that. And if you have to put it at every hour and then it goes on, ticking up and all of that, I hope that will be able to wake that child up and then he will realize that, look, what is the thing at this point in time that I need to go and use the battery.
Exactly.
Yeah. Then another important one is counseling. Like we talked about before, most people think punishment, and when I talk about punishment, like Dr. Warrior said, the different kinds of punishment, I'm talking about flogging and the rest that the certain measures people use, those ones are not appropriate. You should be able to talk to your child, at least tell them that, okay, for dry nights, you give them certain kinds of awards and rewards. You understand what I'm talking about? And also, the parents as well need counseling from the doctors. No parent will come to the hospital telling you that the primary complaint they have is their child bedwetting. These things come along as discussion go on. But the thing is, they should be counseled and they should also be able to pass this across to
tell them what to expect
from these children.
And some parents will just be looking and saying, you don't know my own child. All these people are saying counseling and cognitive and punitive method. It's okay. When you flog the child, it will stop you.
No, but if you have that kind of child that you've done everything for and you're not getting the results you want to get, I think maybe it's time to go to the hospital. Your doctor may want to prescribe some medications that will help the child. That is not to say that you should bombard the hospital asking for drugs when it's not time for the child to use drugs. But the idea is your doctor assesses the situation with you and then decides maybe this child can benefit from so and so kind of medications. And if it helps, that's good for you.
Exactly. Really. Another measure of coping, like using waterproof mattress. I would suggest that as opposed to using diapers, because sometimes these kids can get, these diapers are very good nowadays. They keep them very dry. They even say so in their ads and stuff, and they feel comfortable. But if you use the waterproof mattress, the sheets still get wet.
Especially for older children. You won't put diapers for a 7-year-old.
No, for kids at least to train them, to train the bladder. So the sheets are wet, they get up. You don't need to scold, but they have to understand that, oh, this has happened. They have to, at least, if they cannot wash it, let them assist you, take it to the bathroom, you soak it, see the effort. It is training them to stop the person, because there's no child that would like to do that, okay? So you want to use the waterproof mattress. That should help.
All right. So, you know, there are many more tips on how you can help a child, you know, stop bedwetting. Dr. K, do we have questions from us?
Yeah, we have a very long email from Jennifer. I'm not going to read her long email. I'm just going to give a brief summary of what Jennifer is trying to say. Jennifer says that, one, she's a meticulous mother, and she has a child who bedwets more than 2 times, sometimes 3 times at night. She explains that how she knows that is when the child bedwets, she gets to change the waterproof cover on the bed, put a new bed sheet for the child, and 2-3 hours later she's back, the bed is wet again. She's worried, is that just normal bedwetting, and what could she do about that?
How old is the child?
Jennifer didn't tell us the age of the child, so we're going to ask her to tell us the age of the child. But most important, Jennifer, I think I want to encourage you first of all for being a great mom, changing it over and over at night, and I hope you do get enough sleep at night.
I know.
But that aside, you may want to sit down with your clinician and discuss this condition. Bedwetting is bedwetting. The child shouldn't be ashamed of whether he did it once, twice, or 3 times. Bedwetting at night is bedwetting, but your clinician may want to guide you better on what to do concerning your child. And thanks, really. You can always go to @WeTheDoctors and send us more and more questions, and we'll discuss them here on our show.
Okay, so that has been our episode for today. We'll be talking about bedwetting. And remember, it's all about patience and understanding. Please don't punish that child. If you want to take the child to see the doctor for counseling, we are always willing to help. And of course, remember to reward that child when they eventually wake up in the morning dry. So when they remember that, oh, when I did not wet the bed the other day, mommy got me something. You know, you don't have to go and buy a gift. Something as simple as having more time watching television, or taking them to visit a friend that they like spending time with.
Dr. Jules, let me come in a bit. There's a question I expect parents to ask before they punish the child.
What?
Did I bedwet as a child?
Boom.
Because it's probably your gene that is being replicated in your child. You know? So if you ask that question, I think it helps.
You know, but it's just normal the way every parent came first in school. So
everybody always has nobody came last. Anyway, if you want your questions answered, cooltv.cool, that's where to get the information about the show. And you want to follow us on Twitter, it's @WeTheDoctors, and we're always happy to answer your questions. For myself, Dr. Jules, Dr. OK, Dr. Yvonne, and Dr. Valeria, we are saying bye-bye and stay healthy.